Thank you, Mr. Chairman. Ms. Tavener, I have some questions for you, but first, Mr. Werfel, I just wanted to revisit a bit of the dialogue that you had with Mr. Jordan earlier. He had asked you if Ms. Hall Ingram was in charge of the department that oversaw the targeting of conservative groups, and what was your response to that?
My response is that Ms. Hall Ingram has specific ACA responsibilities, but there are other individuals within IRS who have responsibilities at the same level. But Ms. Hall Ingram does play a coordinating role amongst our various ACA activities.
Okay, and one thing we've had, I guess, a hard time getting anyone from the IRS to say in multiple hearings that we've had is that the IRS was guilty of targeting conservative groups. You stated that you are the most senior accountable member at the IRS currently. Is that correct?
That is correct.
Are you willing to go on record today and tell the American people that the IRS did target conservative groups?
I've testified previously that I believe the use of political labels to screen out applicants for increased scrutiny, inappropriate political labels, is equal to the term targeting. So I don't dispute that.
All right. Well, it's been hard to get someone to say that, and I know that moving forward into this health care law that you have a credibility issue with the American people, and I think it's very important that you be forthright, and I appreciate you saying that today when so many others have taken the fifth. Ms. Tavener, you had testified earlier about the preparedness of the CMS, and you're feeling pretty comfortable about the ability to be ready on October 1st. Okay, I'd like to submit for the record, without objection, Mr. Chairman, the data collection instrument from the GAO report from June 2013.
Yeah, without objection.
Okay. Ms. Tavener, we have a document that was obtained that shows that CMS had only completed 20% of its work to establish appropriate privacy protections and the capacity to accept, store, and associate and process documents from individual applicants and enrollees electronically, and the ability to accept image upload associates and paper documentations received from applicants and enrollees. So the fact that Obamacare became law in March of 2015, but yet as just a few months ago, the administration had completed only 20% of its work to establish appropriate privacy protections and capacity to accept, store, associate, and process documents from individual applicants. Why would you say the administration failed to prioritize privacy protection and data sharing standards?
I can answer that, Congressman.
Well, Ms. Tavener, first you go ahead, and then I have a question for you, Mr. Cho.
Well, first of all, I would say that GAO reports and other reports are taken at a snapshot in time, and a lot of work has been completed since that time, and I will let Henry speak to the details of that.
Okay. Mr. Cho, are you 100% finished establishing appropriate privacy protections?
No, we are not.
Okay. If not, how much and when will you be?
I think since the last report, we're probably, and this is a very kind of hot ballpark, generalized, roll it up kind of a figure, I would say, with regards to privacy and security, we're probably about 80%.
Okay, so the snapshot a couple months ago, you're at 20, and now you're saying you're at 80. Are you going to be 100% on October 1st?
Yes.
Ms. Tavener, do you feel that that's reasonable, that in 3 years you got to 20%, and now in 75 days we're going to get to 100%?
Yes.
Okay. Also, there's 25% of the work to establish the adequate technology infrastructure and bandwidth to support all the activities with respect to the exchanges. Again, why did the administration fail to prioritize this sooner? I'll ask the same question, Ms. Tavener.
I don't know that it's a failure to prioritize. There's a certain workflow that has to actually, first you have to put the regulations in process, then you start to develop the product from the regulations, and this is just the work in progress as any complicated project. We're now within the 90-day period of completing the work.
Okay, Mr. Cho, the CMS document given to GAO says that the estimated completion date establishing an adequate technology infrastructure and bandwidth was July 1st, 2013. Did you meet your deadline for completion of this task?
We have, it's a constant changing target because the target is actually—
So the deadline's moving?
No, the target is October 1st, and we make adjustments as we go to make sure that that target of October 1st is not missed. As of this month, all the infrastructure and the required hardware, software, capacity, all of that is available and up and running. The specific application software, such as the My Account that I talked about earlier, the enrollment and eligibility pieces, the loading of the QHP information to process an enrollment and a payment to an issuer, that is an ongoing process. All of that code and those databases are still being built throughout the summer.
Okay, so both of you are testifying today that these shortfalls that are in the report that I mentioned are going to be 100% complete on October 1st.
Correct.
Ms. Tavener?
Yes, sir, and we certainly will have mitigation strategies. I think someone mentioned earlier in our opening comments that we will be prepared. We will start October 1, and we will certainly have hiccups along the way, and we are prepared to deal with those.
Okay, real quickly, when did you learn that the employer mandate would be delayed?
When did I personally? June 24th or June 25th?
Why did the president wait till July 2nd to announce that?
I don't know. It was not part of that discussion, but I actually was made aware that it was being considered on June 24th.
All right, I yield back, Mr. Chairman.